Good afternoon, everyone. This is Mike here with the E-QIP initiative, and welcome to the next webinar in our Supporting QI series. Today we're going to be looking at sustainability and spread, and really happy that you could be here joining us. So just some technical information before we get going on the content. To let you know that the audio has been muted. So you may be yelling at us, but we can't hear you. But we would ask if you have questions or comments throughout the session, use the chat feature on the GoToWebinar control panel or the question feature. Either one of those is fine. And we'll be monitoring that on our end, and we'll then ask the presenter the questions from here. So feel free at any point to type in any comments or questions as you think of them. We usually try to hold the questions, though, until either a break where the presenter lets us know to take questions or till the end. So we'll leave that up to their discretion. All of the PowerPoint presentations will be made available to you following the day. And I think if my technical ability has actually worked out this time, the PowerPoint presentation should be in the handout section on the GoToWebinar dropdown. So you can get a copy of it now and follow along. We'll ask you at the end of the webinar series to complete a very brief feedback questionnaire for us. We just use that to try and do our own QI and improve the delivery of these sessions for future. And if you have any topic ideas, things you'd like to hear about, the chance for you to let us know as well, and we'll try to make sure we take those into consideration. A thing that I often mess up, so I thought we'd make sure you know about it. The GoToWebinar control panel sometimes can minimize, and if you click that kind of orange arrow button, that can bring it back to full and give you back the question pane where you can type your questions. But if you do want to minimize it, get out of the way so you can watch the slides, you can click the arrow the other direction and it'll minimize. Throughout today's webinar, we are going to be tweeting. We're trying to, of course, always promote quality improvement in community mental health and addictions and share some of the great work that's going on. So we'll be doing some live tweeting today about the session and some of the things that are shared. So we would encourage you, if you are on the Twitter and you'd like to join the conversation, please do that. We have the hashtag, which is E-QIPON. And you can follow along either looking at CMHA Ontario or at AMHO, and they'll be tweeting out during the session. So we encourage you to join the conversation. So before we begin with the sustainability and spread portion of the webinar, for those who may be new to hearing about E-QIP or to joining our webinars, I'll provide just a very, very brief background about who we are and what we're doing. So the Excellence Through Quality Improvement Project, or E-QIP, is an 18-month partnership project between Addictions and Mental Health Ontario, Canadian Mental Health Ontario, Mental Health Association Ontario, and Health Quality Ontario. So it's a three-way partnership, and it's really the first of its kind within the community mental health and addiction sector, supporting quality improvement. So we're very excited about that, and really we're trying to support the work that you folks do and continue to build that capacity and that culture of quality improvement. To do that, we've been providing a number of offerings to the sector, and this diagram represents that. We've been offering things like quality improvement and data coaching to a number of project teams. We've been offering webinar sessions such as this one, and I'll just mention it now. All of our webinars, both this one and all of our past webinars, are recorded and available to you, and we'll share out that link at the end of the day. We also have a community of practice, which you're certainly free to join as well, and that houses a lot of great tools, resources, information, past training, and webinars, as well as linkage to the IHI Open School, which is a great self-learning platform around QI. So again, we'll provide all that information at the end of the session today, and you're welcome to join and have access to those resources. So enough of the excitement of me talking. I'll pass it over to our great guest speaker that we have today, Alice Strawn. And Alice is actually a kinesiologist by designation, but somebody who I think is really an expert in the world of QI with certifications in Six Sigma, Lean. She's also a professional facilitator, as well as holding a improvement advisor designation. And currently Alice is working as a quality improvement advisor with Health Quality Ontario, and specifically with the IDEAS program. And I'll also mention, just from an E-QIP perspective, Alice has been very instrumental in working with us to help bring the IDEAS training to the community mental health and addiction sector and adapting it for us. So it's been an absolute pleasure to work with Alice, and I know she'll bring lots of great information and insight today. So without further ado, Alice, I will pass it over to you, and I will give you control of the mouse.
Perfect. Oh, okay. It wants me to, yeah. That's okay. But if you just want me to control mouse, I can do that as well.
It's only a matter of time before I mess up on these technical things, so there had to be one in every session.
Talk amongst yourselves. When Michael said at the beginning about you're on mute, if you're yelling at us, we won't hear you. I like to believe that you're clapping for us, and we won't hear that either. So maybe that's a bit of a different perspective on your muting. So thanks, Michael. And let me just make sure that my forward and back is working. I don't know that I have control. I think you do still, Michael.
Oh,
we can
moving.
do it this way. Yeah, oh, maybe it is. All right, let's go. Oh, I think that is me. All right, here we go. All right, thanks, folks, and thank you for the great introduction, Michael. It has been lots of fun to work with this program, and to work with the coaches that have been involved with the program as well. And I did have the privilege of attending some of the project presentations that went on earlier this year, and kind of felt like the proud mama in some ways, because from nothing to certainly something and more than something, it was great to hear about the progress that people are making. One of the main questions that we do get when we work in quality improvement, and one of the main struggles, if you ask people sort of post-project or post-intensity of a project, what is your biggest struggle? They will say to sustain and or to spread. And one of the biggest questions we get asked is, what can we do to sustain and spread? And I think I could probably make a lot of money if I could just come up with the answer for that. So I'll start off by setting the context today and saying I don't have the answer. I have some models. I have some information based on experience. I have some recommendations. But I think one of the challenges around sustainability is that there isn't just one answer. There isn't just one way. And that that is what makes it both exciting and challenging at the same time. So today I will talk about the factors certainly that need to be considered. I don't have the answer to those factors, but I could talk about areas that are important to think about. Talk about a few things you might want to do in terms of action items, some immediate to-dos, if you like, that you could be looking at around this. And I'm going to talk about a couple of different models and tools that are out there. Certainly, I'm not going to talk about all of the models that are out there. You'll be able to find lots more information on a web search, but I'm going to use a couple of them that we've had some experience with and ideas that we found to be most helpful. So, what is it? Why are we talking about this? And I draw your eyes to the graph, the chart that's on the left-hand side of the screen right now. And this could be ABC project, you name it. But what we often see is, sort of a before. Here's where we started down in that lower left-hand corner. Here's where we got to, and then something changes and things start to fall off. And often that's the point at which people feel that they have been able to initiate some change, they have made some improvements, and they may take their foot off the gas a little bit. And sometimes when we take the foot off the gas, things will sort of put forward, as you see in the top line, but more often than not we see things start to peter out. And so why does that happen? The other thing that we see, the top graphic is meant, on the right hand side, is meant to show you is these islands of improvement. The fact that we see things that are great in one unit, fantastic in one office, really work well with one psychologist patients, but doesn't seem to go beyond that one little spot. And you know, not only does it not spread beyond, sometimes the learning doesn't spread beyond as well. So how can we try and facilitate that? And the bottom photo, the sort of explosion there, is something that we often caution against. As much as we want to sustain, and we always want to take the great work that we've done and share it with others and help it to happen in other areas, my caution on all of that is a phrase we use quite often, which is we want to be careful that we're not spreading a mess. And so if we're not sure that the work that we've done is sustained in our own environment, or if we haven't thought enough about the environment that we're trying to spread to, we do have that potential to spread a mess. And you know, there's all kinds of sayings about spreading a mess. There's the one about the matter and the fan and all of those. And no matter what phrase you want to use, that's something that we want to avoid. We want to be sure that whatever we're spreading is not a mess and something that does have the ability to be an improvement either on a larger scale or in another environment. Just wanted to address some language, a glossary, if you like, before we go any farther, because there's lots of words around this, and like many different areas, we tend to use some words interchangeably. They may or may not be interchangeable. So when I talk about sustainable, one of the phrases we sometimes use about something being sustainable is that it is hardwired. That wherever it was that you were trying to create improvement, whatever your laboratory was, if you like, for lack of a better term, whatever you were trying to improve and the new processes that you put in place or the improvements that you made to the processes are now hardwired. And one of the ways of thinking about this is that if the person who was most responsible for those improvements being made left the organization, something is sustained if you are confident that that improvement would continue. So that's the framework around which I use the word sustainable. When we spread something, we take what we have done in one part of the system and spread it across the system. And often that means sort of at the same pace and at the same size, if you like. So if we did something in one program, we take what we did in one program and we put it into another program. So we, you know, basically take what already exists and use it somewhere else. Scaling up is a little bit different than spreading in that scaling up looks at both increasing the size of the changes that you're making as well as tailoring the approach to that new system, that new laboratory, if you like, that might be unique to that local setting. So some things that we can sustain can just be spread. You can take it from A, put it in B, and it will work. But sometimes it won't work in B, C, and D. And that's where we may need to look at scaling, which is how do we take what worked in A and make it work in B, C, and D? Or maybe we just have to look at C and D. But the recognition that sometimes you cannot cut and paste, that you need to be able to be flexible and tailor in order to meet the needs of a new environment. So let me pause for a moment and run our first poll. Michael, I think you're going to need to run the poll for me because I don't see poll on my toolbar. So the first question we'd like to ask you is, and you can just poll by selecting an answer when it comes up on your screen, where are you at currently in terms of your QI initiative? Are you not doing one right now, so it's what initiative? Are you testing and beginning to think about sustainability? Because of course we want to be thinking about sustainability all the way along. Are you already planning for sustainability? Are you beginning to think about spread, or are you getting ready to scale up? So if you can just choose one of those answers, just curious where folks are who are on the phone today. And Michael, once you see the majority have voted, maybe you can close the poll and share the results.
Okay, we're at 60%. Let's give folks another minute.
Excellent. So Michael, maybe you can just share the, oh, there we are, thank you. Oh, so interesting. Okay, so a few of you are not involved in any QI initiative right now. That's great. So food for thought, if you like. Thinking about sustainability at the beginning of your test of change, that's great. Planning for sustainability, about 38% of you are doing that. That's fantastic. Thinking about spread and scale, a few less of you, and that's not unusual, of course, because that's a little bit farther down the road and a little bit deeper into a project, perhaps. So interesting to know that most of you are in that thinking about it or beginning to plan for it stage. That's great. So moving on then, when we're thinking about, oh, come on, as I say, moving along. There we go. So let's talk a little bit about sustainability. One of the big questions we get all the time is, when should we think about sustainability? And my answer is right from the get-go. So as soon as you begin to think about, there's something we want to improve, there's something we believe in our work that we can do better, we have a theory that if we do this differently, it will improve outcomes for our clients, our patients, our consumers. That's also the time to begin to think about sustainability. And you may have had experience in being involved in changing something that relied on somebody just doing more work for a while. What if I just, work an extra hour every day? I wonder if that would improve access to our program. And gee, no surprise, working more creates more access. But is working more really sustainable? And is it really sustainable if it's just one person? Probably you, who are most keen about the improvement, doing it. And is it going to work when you suddenly decide, I can't work this extra hour every day anymore, I'm going to ask somebody else to do it? I think the answer to all those questions is that ain't going to work. So how can we think about sustainability right from the beginning? One of the models that I will point you to is the NHS Sustainability Guide. This tool is available. Do a web search. Michael, you may have it in your toolkit on your website as well. Although the NHS in this form does not exist anymore, the Sustainability Guide is still available on the web. And the Sustainability Guide can be used at any point during your QI project, and I might suggest multiple points during your QI project to have a look at what's the lay of the land in terms of our chances of being able to sustain what it is we're trying to improve here. So the way in which it works, it looks at three key areas. It looks at an area around staff, it looks at an area around organization, and it looks at an area around process. And within each one of those areas, staff as an example, it breaks it down into smaller components. Things like, what are our senior leaders thinking about this? What are our clinical leaders thinking about? What are our behaviors around this? Within our organization, what's our infrastructure to be able to sustain this? Within our process, what are we doing to monitor the progress of our changes? What's the credibility of the evidence that we've used to make this change? What's the benefits beyond helping our patients or our clients? And it asks you a series of questions in each one of those sub areas. And the questions are weighted, the answers are weighted, and the tool will actually give you an overall score. The score itself isn't as important as the discussions that you have when you come together to talk about the way in which you scored these areas as individuals. So we promote using this tool individually first with the members of your project team, ideally some frontline folks in there. Then coming together to talk about how you scored things. And it's the discussion that comes out of the differences in the scoring that is critical to being able to think about the sustainability. Because as an example, if you're coming together as more than one organization, and in your organization, you have great clinical leadership support, and you have fantastic senior leadership support, but the other organization that you're working with, who you rely on quite strongly because perhaps they're the direct program provider or the direct service provider, they don't have that same level of senior leadership support or clinical support. The richness of the conversation becomes about how do we generate that level of support as we're working on our project so that we are more likely to be sustainable once we've improved the processes that we're working with. The NHS used to put a score, well, there is still a score, you do get a total. And there used to be a qualifier on that total, and it used to say something like, you know, between a, or below a certain score, you shouldn't even continue with this project. But they took that away because they realized that to suggest that it's a stop dead without being able to go back and look at what you might be able to improve is really not in our culture of QI, and that better to think about what can we do to, for lack of a better term, improve these scores than it is to say, yeah, you know what, let's not even go there. However, if you did have this conversation up front and you did realize that there were some barriers that were going to make it extremely difficult for you to proceed, you might want to sit down and have a real hard think about the project and think about, you know, what do we need to do? Do we need different partners? Do we need different resources? Do we need to come at this a different way? Do we need to do this at a different time? Before you begin to bang your head against a wall with a project that has a lot of barriers in it. The other reason for thinking about this very early on in your project, and that I would encourage you to go back and do it a couple of times, it does not take long to score with this tool. Go back and do it a couple of times, is that as you're working through different phases of your project, you want to keep track of all of these things that are important to us around this project, staff, the organization, and the process. How are they relative to where we're at with our project right now, and what might we need to do in order to ensure that we are continue to be at a level at which we can sustain. Nothing worse than launching a failed project. And I don't mean failed as in failed, but we learned. Failed as in there's so much resistance to it, the project can't help but fail. And sometimes I would suspect that if some work was done looking at sustainability and looking at some of these pieces right from the very beginning, the launch might have gone differently, and therefore we wouldn't have launched something which staff perceived to be a failure, and therefore it becomes very difficult to go back a second time and try again. So, you know, it's a great diagnostic tool. It looks at all these different factors and something that you might want to think about. But I want to go back to our QI guru, Deming, who probably said it best. And, you know, that although all models are wrong, some models are useful. So that NHS model, interesting concept, interesting tool. I've personally used it for quite a period of time. I like it, but it's not to say it's the only way of looking at sustainability. So let me share with you a different model. This one comes out of the 5 Million Lives campaign, which, as many of you probably know, was a campaign that IHI ran quite successfully, headed by, I believe, Don Berwick was still the Chief Executive Officer of IHI at this point in time. And it was a system-wide approach to trying to decrease medical errors and therefore save or improve the lives of 5 million people. And so this model looked at 6 key factors that were, I'm going to say, vital in order to ensure, or ensure is a big word, let's not use that one, in order to help facilitate the sustainability of your QI project. Now you'll notice some similarities back to what you just saw in the NHS Sustainability Guide. A little bit of a different focus, but I'll crosswalk you between the two as well. So supportive management structure, structures to foolproof, feedback systems, data, shared sense of systems, culture of improvement, and capacity building programs. So let me say a little bit about each one of these. I want to liken this a little bit to baking a cake. That, you know, the environment in which you're baking the cake is your oven, and the quality of the ingredients that you're using and the tools that you're using to mix things together. But if we have that right environment and we bring these ingredients together, these 6 ingredients, we have a better chance of making a cake called sustainability. So the first piece around this, of course, is supportive management structure. And I don't think this is a surprise to anybody. If leadership does not see this as a priority, allows time for regular attention, protects time to work on a QI project, designs systems that help you with data and accountability, you have a much lesser chance of being able to succeed. The NHS Sustainability Guide deals with this under the piece called organization. So not rocket science. We need to have a supportive environment that we're working with, most specifically the management, in order to make this happen. And you know, sometimes try as we may to believe that we can prove them wrong, we better make sure we've got some support within the organization, because otherwise the reverse might happen. So thinking about how do we bring those people on board? How do we inform them? How do we keep them informed? How do we engage them in the project so that they understand what it is we're trying to do and they can be supportive of the resources that we need to do that work? The second ingredient are structures to foolproof, and you notice that foolproof is in quotation marks because, of course, we can never foolproof everything. But what do we have in terms of infrastructure? IT, do we have the resources available? Do we have the space to do what it is we want to do? Do we have the signage that's needed? Whatever we might look at in terms of hard infrastructure, or can we make it available so that we can, as much as possible, embed our changes so that they become, for lack of a better term, forced functions within the way in which we do our work. So if there is a certain form that needs to be used and it's in a computerized medical record or record keeping system, can we make it so that we cannot possibly proceed in whatever it is we're doing within that record without actually addressing or using that form? The more we have our improvements built in as forced functions, it is extremely difficult to do it the old way, because the new way is a forced function, the more likely we are to sustain. Now that sounds kind of harsh, right? It sounds like we're trying to force people. We're not. What we're trying to do is to make it such a natural, unavoidable part of the workflow that we can't possibly do it any other way. And if you ever want to think about a good example of forced functions, the next time you go to an ATM, pay really close attention to the order in which things happen when you go to an ATM, and think about the fact that the order of those functions has changed. So when you get money from a bank machine, one of the reasons why they spit your card out before you get your money is that when they used to spit your money out first, people would walk away without their cards. But when your card comes out first, but your money is the last thing to come out, you are not going to leave your money behind in that machine. So the forced function is they prove that people forget their cards less if you spit them out first than if you spit the money out first. That's an example of a forced function. It's not harmful to us. It's not making us do anything that we don't want to do, but it's making it such a natural part of the workflow in that case that it's very hard for us to make an error and leave our card behind. I probably don't need to say a lot about the importance of data. You know this. Not only the collection of data, the regular monitoring of data, but the regular sharing of data as well. And another really important conversation around sustainability is, what is the sustainability of the data collection process that we have put in place? So let's make sure that we haven't created such a difficult way of collecting data that we're never going to be able to sustain this. That if it's taking a huge amount of somebody's time to collect data for us, we probably need to think about streamlining or a different way of collecting that data so that we can sustain the ability to be sure that we are continuing to experience the improvements that we've made. The other thing to think about is that sometimes as we create improvement in our systems, there is some data we can stop collecting. So once something becomes firmly embedded, if it's a forced function as an example, we don't need to count the number of times it gets used anymore, because you can't possibly go forward without it being used. So think about, as we go forward, are there pieces of the data collection that we no longer need so that we can focus our resources on those that are most important to helping us to understand if we've continued to sustain all that great work that we did. The fourth ingredient is that, you know, we need to all believe that this is better, right? Everybody needs to believe that this is better. And I will reference you to, I haven't got information in the slide deck about, but I will reference you to some information that Dr. Chris Hayes was working on when he was doing his IHI fellowship. It's called Highly Adoptable Improvements, and there is a website, HAI, Highly Adoptable Improvements, where he talks about in order for people to have this shared sense that what you're doing is better, they need to understand or experience three things. They need to understand the value of what you are proposing to change or that you have changed to them. Personally, I'm always interested in how does this work for me, the what's in it for me approach, or the clients that I serve, Do I have the capacity to be able to do what you're asking me to do? So do I understand how to use this form? Do I know where to go to get that piece of information? Do I know how to run this test? Do I know how to do this assessment? Do I know where to find this brochure? And the third thing is that I must feel like I have the competency to be able to do this. So the ability, the formal knowledge, if you like, that it's within my scope and I know how to use this. And if I see the value, I know how to do it, and I have the capacity, i.e. the time and the workload as well, then I will be more likely to have this shared sense that this is better. And by the way, when you talk to others about workload, don't lie to them. If it is going to increase their workload for a short period of time as they learn a new way of doing things, you need to be honest about that. But you also need to be honest about whether or not that increased workload is going to continue. And if it is, you probably need to have a rethink about where you're at anyways, because again, over time, as much as we'll give it our all for a while, over time we're not going to continue that intensity. We need to have this culture of improvement and engage staff, right? And again, this starts from the very beginning. This is addressed under process in the NHS Sustainability Guide. The more we involve the frontline folks and our executive sponsors from the very beginning, the more we are to be able to develop this shared sense of we live in a culture of improvement in this organization, and as staff, we are involved in that improvement, and we believe in it, and we see it as part of our everyday job performance. And lastly, but certainly not least, is this idea of that we want to be sure that we are building capacity for people, so that, if things are going to be done in a different way, if we're going to be using quality improvement tools that we want others to see the benefit of, then spend some time in training folks in how to use those. Doesn't take long, quick little lunch and learns, however you might want to approach it. But people need to understand the language, if nothing else. Let them to understand what a PDSA is. Help them to play around with root cause so that they feel that they know the words and they know how to use those tools in their everyday jobs, so that it really just becomes this sense of problem solving using a QI approach versus identifying problems and not being able to do anything about them. So, what are your next steps around this? Well, ask yourself, again, whether you use the NHS tool, because there is a crosswalk, or whether you use these 6, how are we doing in these areas? And what could we do in each one of these areas to strengthen our chance of success in being able to sustain our project, sustain our work? And within the slide deck, you will see the link to being able to get to the NHS sustainability model, which is the one that's pictured on the screen here. And those 6 ingredients, the IHI getting started, that's the second link on this slide here. So you'll be able to get right to both of those resources very easily from this slide. Now, another very smart person said, plans are nothing, but planning is everything. And that's Dwight D. Eisenhower. And so plans, I think what his intent behind this was to say that when we write things down, when we plan for things, if that's all we do and it becomes very static, it's probably not going to be very supportive when things aren't going well. However, if we are always planning, then we are more flexible, more agile, more versatile, and more able to react to things when they present challenges to us as we're doing our work. So let me launch a second poll here. Michael, if I can ask you to launch. Based on what I've just said, how are you feeling right now about your chances of sustaining the improvements that you've made? Are you confident, very confident, so-so, feeling kind of sick, or thinking about that snowballs? Oh, that's a chance. That's my bad typing there. What do they say about a snowball's chance somewhere? My bad typing. And Michael, maybe as we're filling out the poll, are there any questions that I could address at this point?
Now, one question that came up during a chat we had actually with the project team earlier this week was around the issue of measurement. And we had talked a lot about, when you're doing your quality improvement project and you're running your PDSAs, measuring at a minimum your outcome once a month and your process measure once a week, which is kind of the minimum, I guess. We'd want to be capturing that data. But I guess moving to sustaining something that's already been tested, how do you begin to taper down that measurement, but also not lose sight of what it is you want to keep an eye on in case things do go awry in future? Is there any guidance or suggestions that you would offer around that?
Yeah, and that question comes up quite often, and it's a good one. The answer is not a good one. It depends. One of the things we often, when people say how many surveys should I do? How many tools should I do? How many patients should I ask? How many clients should I talk to? The answer really is enough so that you are confident that what you are seeing is a good representation of the way in which your system is performing. So, to use hard numbers, and just as an example, if you collected 15 of something, whatever the something is, and the 15 was identical, then you can be pretty sure that you've got a good chance that things are as they are, because 15 samples told us the same thing, 15 instances if you like. However, if you took 15 measurements and they showed you 15 different things, then you need to measure more. So a lot of it is really based on what's the variability in your system, because it's obviously that variability that will give you variability in the performance and in the data. But you are correct in one of the most important things is to keep your eye on that so that you're not continuing to check to collect things just because you always have, when really the pattern is quite well established and there isn't any need to continue to put the resource into that. The other thing is to have identified, do you have seasonality? So do you have certain things that happen at certain points in time that always affect the performance of your system? So in primary care, as an example, we talk about flu season. Flu season happens every year. So it isn't unusual. And so we don't need to worry about the blips that happen in flu season because it happens all the time. And if you have that kind of seasonality, something that happens all the time, holidays, interruptions in programming due to funding cycles, any of those kinds of things, don't worry about those blips because they happen all the time, and you almost want to ignore what happens during that time because it is actually contributing to the variability that isn't actually real. It's there because this is something that's happening in your system on a regular basis. So I hope that answered the question, because it depends is never a good answer, but it does depend. So great. Oh, sorry, yeah?
No, I said thank you, Alice. That's helpful. Would you suggest, just to follow up on that, would you suggest carrying on measuring once you're sustaining and you have a well-documented, say, success or improvement, continuing to measure for any period of time your outcome measure long-term, maybe setting aside the process measures, continuing to measure your outcome measure just to keep it as an eye in the background? Or would you suggest, once you have a well-established, sort of moving on and then revisiting it later if needed or something?
Yeah. Chances are your outcome measure should be connected to something within your organization. It's either connected somehow strategically into your operations and how you measure your effectiveness as an organization or as a program, or for some it may be connected into their quality improvement plans, in which case that outcome measure is always going to be there. You're always going to be collecting data on that. And often that outcome measure is a tougher needle to move, so you do collect it over a longer period of time, in some cases quite literally forever, because it is that system level indicator that you've always got your eye on, and it is that big needle that's a bit harder to move. So part of it is looking at how is it connected into the other strategic things your organization is doing that they would be collecting data about on a regular basis. So good to see about half of you are confident that you've got some chances to sustain. So let's flip a little bit now and talk a little bit about spread, which is kind of this concept of if we baked a cake, now how can we, have cake for everybody? How can we spread what it is we've been able to do and be able to share that? Now, these next few slides are fairly dense, and so I would suggest to you that they're good resources. They're pieces that you might want to have a look at when you're reviewing the slide deck that you can access from the deck that's here. For some reason, I am not moving forward here. Come on. There we go. And really, one of the message that I want to give you here is that when you spread, you are back in PDSA mode again. Because what you are doing is taking your theory, this worked here, now I want to make it work there, there, and there. And that means you are testing and you're trying and you're adapting once again. So it very rarely is that cookie cutter approach. It very rarely is just pick it up and move it over here. One of the reasons for that is because when you spread to a new environment, chances are what you are actually running into are people who were not as intimate with what you were trying to do in your original project and therefore may have a different perception of A, the need to improve, and B, what it is you're suggesting they do to improve. So this piece comes from Val Alstead, who presents on adaptive leadership in the advanced learning program. And this has to do with the work of Dr. Heifetz on adaptive leadership. There's a couple of books out there. Actually, I noticed yesterday he's just published a new book on adaptive leadership, which I want to try and get my hands on. And it talks about your ability to influence others and to get other people to be as excited about and to want to change as much as you do. Is there a capability? So here's that word capability coming back again. Can they actually do what you're asking them to do? Plus their perception of the potential benefit, value to them, and their perception that that's really going to happen. So I know it would be better, but I feel like this is flavor of the month. Well, then your chance of that actually being able to spread are less. Versus, I know this will be better, I know I can do it, and it looks good. They showed me some data. It worked over there. I think it will work here and I'm willing to try. So you take that and then you subtract their perception of cost. This is going to be way too expensive. Or, gee, this is going to save resource. And their perception of risk. And risk, of course, is a very personal perception and is tied right back to the value that they see for themselves and the system they work in and their perception of their capacity, their capability, to be able to do what it is. The reason why this is so hard, it's about perception, not reality. So we need to help people to understand what is real in what you're asking them to do and what is their perception of what might happen. So how do we do that? Well, first of all, we have to know who all these people are. And that means we need to understand who our stakeholders are. And so when we talk about our stakeholders, we want to know what's important to them and what matters to them. So what do they value and what matters to them in terms of the work that they do. And one of the tools, and again, this is in your deck, you'll be able to see it, and it does come from adaptive leadership again. Michael, if I haven't shared this tool, I can share it with you as a PDF, is to actually look at who are your stakeholders, what's important to them, what are they, what are their loyalties, what is important to them in how they do their work, and what is it that you need to do in order to engage them to help them to understand their role in the change. Now, some of these people are internal to your organization and some of them are external. But as you're doing this work around stakeholders, one of the things that I would challenge you to think about is, and this comes from the work of Helen Bevan, think about your strong ties versus your weak ties. So your strong ties are like that little group down in the bottom left-hand corner. They're your initial project team. They're the people that are as excited about what you did initially in your project as you are. You interact with them every day. You get along. You like working together. You like meeting together. You probably have had some conflict, but you worked it out, and you're a good group of people having fun doing this work. They're the easy ones. The harder ones are your weaker ties. Who are they out there who we either don't work with or we know are a bit skeptical of our work, so we avoid them, or they work different shifts than us, or they work in a different organization, or they work in a different program, or they have a different designation. Those are the people, those weak ties, that become extremely important when we're trying to spread our work, because they may have been those who we didn't go to initially because we didn't see them as champions and supportive of what it was we were trying to do. But now, as we want to spread, we need them on board. And so when you're doing that stakeholder, think about who are our weak ties and what will we do to engage with them. So let me just ask you to reflect for a moment with another poll. Do you know who your strong and weak ties are? And Michael, maybe as we're voting again, is there any other questions that I could answer at this point?
No, there's not been any other questions
Okay.
during this part, but I just want to remind folks too, if you do have questions, either type them in the question box or the chat box. Either way, we'll see them on this end.
Okay, so about half of you feel like you've probably got a pretty good idea of who your strong and weak ties are. So of course now the next step is we need to communicate with them. We need to understand the value and the capacity and the capability of them. We need to understand how to help them to see value and to understand that they do have the capacity and the capability to be able to do what it is we're asking them to do, so that when we do go to spread, they are as informed and excited and supportive of what we have created as we are. And one of the hardest things I find, and I talk with good conversations with teams all the time about this, when you are very excited about quality improvement, as I think all of us are, and you get very passionate about your work, it's often hard to remember that others don't have that same passion and enthusiasm right off the start because they haven't been as intimately involved as we can. And so I often catch myself saying, oh, just a moment, I need to back up a little bit and give you some context to this. Here is what went before the fact that, you know, here I am at the front of the room, rah, rah, rah. We're going to do this differently starting today. And so to really remember to provide the context so that they can jump on that bandwagon with me and be as excited and passionate about what it is we're trying to do as I may be. And knowing that I have a lot more information at my fingertips, including data to prove why I think spreading this is a good idea, that they don't have access to. So taking that time to really inform people and to listen to them when they want to send up some red flags for us. The naysayers are very, very important in all of the work we do. And the naysayers suggest to us what the data is that we want to collect that will tell us if what we're trying to spread is not working. And one of two things is going to happen if you listen to the naysayers and if you collect the data they're looking for. Either the data will prove that they're wrong, okay, or the data will prove that they're right, more than okay. Because sometimes those naysayers might have insight, and if you're collecting data on what they're worried about will happen, and it does, that was going to happen anyways. So now at least you have the data to know, and you know how to go about improving whatever it is that data showed you. So if somebody says this is going to take way too much time, collect information on time. And you know what? If it does take way too much time, they're right. And now you've got to figure out another way. But if it doesn't, they're wrong, and that's okay because we learned from it and we substantiated the theory based on using data, not just by somebody saying you're wrong. So as we move towards trying to bring those folks on, this slide speaks about the importance of those informal social networks. So this is linked very closely to that strong ties and weak ties. Our strong ties are people we like to be with. We like to work with them. We probably have similar opinions. We probably like certain things in our lives. And we can easily go to them for spread. So finding those people and being able to use our social skills in order to bring them on side are extremely important. And they can also help us with some of the other folks out there who might not be so supportive. So thinking very strategically about if we can't just let things trickle out, because that won't help us. We won't be able to get to everybody that we need to get to, but by using our social networks, our champions, our boundary spanners, those are people who maybe work in more than one location, work in more than one program, work in more than one organization. They are the folks that can help us to create those strong ties where weak ties currently exist, because they dip into other settings that we aren't necessarily a part of. So important to think about that. It doesn't just happen by accident. It doesn't happen by osmosis. We need to be very strategic about the social pieces of this. I'll leave this for you. This is part of a model that came out of the Veterans Health Organization. It's talking about when we try to spread. Here is another way. This is another model, another way that we can look at the attributes of what it is we're trying to spread to decide whether or not it actually might be spreadable to another organization. Comes from the Veterans Health Association. Might be administration, the A, I'm not sure. Again, I think you can see some similarity here. Relative advantage, what's the value of what you're asking me to do? How well does it fit with what I already do? That's that perception piece, right? How complex is it? And complexity is directly related to my own concern about my capability, my capacity to be able to do what you're asking me to do. How likely is it I can test this to learn about it? How quickly will I be able to see that it's better? Again, perception and value. And how easy is it to adopt or adapt so that it works in my environment? Can I change a word? Can I change the color? Can I change the time? Whatever the case may be. And that if these attributes are addressed, the chances once again of others perceiving that this is going to help them in their work, and remember how important perception is extremely enhanced. So one last poll, just to ask you about stakeholders in general, is have you had a chance to consider your stakeholders in your spread planning? And again, Michael, if there's questions, I'm happy to try to answer them at this point.
Thanks, Alice. There's one question that you may be addressing later, but came in, is who's primarily responsible for sustainability versus spread?
Who is primarily responsible for sustainability versus spread? I think it's the same, although when you're spreading, what you may do is be taking your good, strong team that you had for the improvement that you sustained. So that would be your project team. That would be your frontline folks who helped you to test your improvement ideas and who are the ones who are now doing things in a new and improved way. And your senior leadership and your executive sponsor where you originally created the improvement. Now, if it's within your organization that you're trying to spread, then that who stays the same. However, if you are involving other organizations or potentially even other significant departments within your organization, there likely is now another parallel of that same group of people, senior leadership, executive sponsor, frontline, project team, in that new organization or new division that needs to help to support the work as well. But it really is that coming from the top. And there are some who will suggest, there was a recent paper from IHI that suggested that spread is 100% an executive sponsor senior leadership responsibility. I'm not sure I ascribe to it being 100%, but I can understand the importance of their role in taking something from one environment and spreading and scaling it to another. So this is good to see. Folks have been engaging stakeholders from the very beginning. And you know, there's about a quarter of you who recognize, yeah, we better do this before we go to the next step. So that's great. Great to see that you're either thinking about it or you have been engaging them right from the very beginning. This next slide again is a bit dense. It's just to go back again to the slide that I showed you earlier and really just reiterate the idea that this really is about PDSAing all over again. This really is about not just assuming that because it worked in A, it's going to work in B and C and D, that we need to have a strategic approach and an email that says, you know, yesterday we did it in Department A and now we'll do it in the whole entire organization is not going to guarantee your chances of spreading, that it needs to be a very strategic and planned approach to taking what you've learned, both the good and the bad, sharing the data in order to spread things either throughout your organization or to other settings. So let me pause there and see if there's any more questions before we just talk briefly at the end about quorum and the way of staying involved.
Let's remind folks again, please feel free to enter your questions in either of those two boxes. We did have one other question, Alice, and it's regards to spread. So when trying to spread something externally, you may have very little influence over the external provider or entity. For example, another provider in the region. Any suggestions for engaging with or trying to promote spread, I guess, externally?
Yeah, and I think what is key is to ensure that you have engagement before you try to spread, and that's tough. I understand. I think you're probably all familiar with Rogers' diffusion curve, right? That anytime we try to do anything that's different, we will have some people who jump on board right away and think it's great, and we'll have some people that'll join once it looks to be proven, and then we have that group over on the right-hand side we call the laggards. They still have flip phones. They aren't going to, you know. They've got an antenna. They don't watch Netflix. They don't do any of those sort of innovative things, and we just accept that. But if we are dealing with 100% laggards, which isn't likely, but we need to find who are those innovators, who are those who are going to be motivated, and work through them. And unless we have that, our efforts to spread may actually backfire on us because those naysayers will become the strong voice. They'll be the, you know, here comes flavor of the month again. Here we go again. This will never work, and that's not the way in which we want to start out. So that stakeholder analysis and the use of those techniques to try and engage those stakeholders up front and first and foremost is extremely important. And we have said to projects in the past, if you cannot engage people in that location or that organization, do not try to spread there. It will probably leave more of a bad taste in people's mouths than it will if we just leave it alone. Maybe leave it alone for now and continue to work on our relationships so that we can develop it to a point where we do have ties. So lots of ways of staying connected, and I've been peeking at Twitter as we've been going, so there's been some great conversations on Twitter as well. So obviously that's always a way to stay connected. Certainly through ideas, and for those of you who may be interested in our advanced learning, there's information on the ideas website. Wanted to talk a little bit about quorum. Michael mentioned it at the beginning, and I know that there is an E-QIP community of practice set up on quorum, and that's a great place to continue this conversation that we've been having today as well. So if you haven't already set up your account on quorum, very simple to do so, and then once you have your profile, you can see all the different communities of practice that are there that you can join and continue on this conversation, ask questions of each other, look for tools and resources, share experiences, and really develop that strong peer learning environment. So I recognize I've gone a minute over today. Thank you for joining us in the summertime. Thank you to Michael and the E-QIP program for asking me to be involved today. And I'll turn it back to Michael to wrap us up.
Great, thanks so much, Alice. I really appreciate all of your insights and knowledge that you've brought to this and shared with us. So thank you very much for doing that. We've had some questions, and I'll continue to push folks. Check out our collaborative community of practice. The link is here. All of the tools, slides that have been discussed today, including things like the NHS planner that Alice went through, will be and are shared on the community of practice, so you can have access to those very easily. And if there's questions or thoughts that come up too, this is a great place that you can share those. All of our past webinars, and these are the list of them here, are available through the community of practice or on our YouTube channel. So you're welcome to check it out. And there's a link in the slides for that. Or visit either the CMHA Ontario or Addictions and Mental Health Ontario websites for more information on E-QIP and the offerings and upcoming exciting things that we have happening. So I'd encourage you to check that out. And of course, in the true spirit of QI, if you could take a moment and fill out the evaluation from today's webinar, that would be very helpful for us in planning future events. And without further ado, again, I'll just thank Alice one more time and all of you for taking the time to join us today, and hopefully you found this useful. So thank you very much, and feel free to reach out to either Lynette or myself here at E-QIP anytime if you have any questions, thoughts, anything at all. We're here for you. Thanks, and we'll talk to you soon.